Papillary renal cell carcinoma, hereditary papillary renal cell carcinoma type 1. Similar to clear cell RCC, papillary renal cell carcinoma occurs in hereditary as well as sporadic forms. A hereditary papillary RCC is an autosomal dominant hereditary cancer syndrome in which affected individuals are at risk of development of multifocal bilateral papillary type 1 kidney cancer. And this hereditary papillary renal cancer develops in the 6th and 7th decade of life, and early onset has been described, exhibit nearly complete penetrance by 80 years of age, and this rare disorder has been reported in less than 35 kidneys worldwide. Then second is hereditary papillary RC in MET protoncogenes. So in 1994, Zabar et al. They described 3-generational family in which multifocal bilateral papillary renal tumors were inherited as an autosomal dominant fashion, and this disorder was linked to the chromosome 3p loss, suggesting presence of new predisposing renal cancer gene and representing hereditary counterpart to sporadic papillary renal cancer. And Smith et al. Localized this hereditary renal papillary carcinoma disease locus to chromosome 7q31. This genetic linkage analysis and identified germline missense mutation in the tyrosine kinase domain of the MET protoncogene in affected hereditary renal papillary carcinoma families. So functional consists of this MET mutation. The MET protoncogene encodes the hepatocyte growth factor HGF and scatter factor SF receptor tyrosine kinase, and binding of ligand HGF, this hepatocyte growth factor ligand 2 MET, triggers the autophosphorylation of critical tyrosine in the intracellular tyrosine kinase domain, leading to recruitment of a variety of transducers of downstream signaling cascades that regulate cellular programs supporting cell growth, branching morphogenesis, differentiation, and invasive growth. All MET mutation identified in hereditary papillary RC are missense. They are all missense and predicted to consecutively activate MET kinase without ligand stimulation. Papillary renal tumors are characterized by trisomy of the chromosome 7 and non-random duplication of the chromosome 7 bearing the mutant MET allele was demonstrated in papillary renal tumors from hereditary papillary RC patients, and the presence of 2 copies of the mutant MET may give kidney cells a proliferative growth advantage and lead to tumor progression. Sporadic type 1 papillary RCC. Sporadic unclassified papillary RCC reported MET coding sequence alteration in 13% of the cases, suggesting a minor role for MET mutation in the hereditary papillary renal carcinoma sporadic counterpart tumors. Subsequent molecular characterization of 161 sporadic papillary tumors by the Cancer Genome Atlas Research Network uncovered altered MET status in 81% of the 75 type 1 papillary RC cases, including sequence alterations, then alternative splice variants, MET gene fusion, and MET amplification due to increased chromosome 7 copy number, underscoring a prominent role for MET in the pathogenesis of sporadic type 1 papillary RCC. In support of this dominant role of MET in sporadic and inherited forms of type 1 papillary RCC, foretinib, formerly known as XL880, a multi-kinase inhibitor that targets MET1 among other tyrosine kinase, evaluated in a phase 2 clinical trial in patients with bilateral multifocal metastatic RCC or hereditary papillary RC with germline MET mutation. Foretinib demonstrated activity in patients with advanced papillary RCC, with highest response in patients with germline MET mutation. And microphthalmia, MIT family, TFE3, TEFB, and MITF renal cell carcinoma. XP11.2 translocation renal cell carcinoma, typically presenting with papillary architecture and clear or eosinophilic cytoplasm, are rare tumors in about less than 5% adults, but are cause of approximately 40% of the pediatric renal cancer. Translocation in sporadic papillary renal carcinoma involving XP11.2 and 1Q21.2 generate a fusion between a novel gene papillary RCC and the basis helix loop helix leucine zipper translocation factor gene TFE3, member of the microphthalmia MIT family of transcription factors, and the encoded fusion protein PRCCTFE3 act as a stronger transcriptional activator than native TFE3 and may drive the development of sporadic papillary RCC. XP11.2 translocation renal cell carcinoma involving at least 5 different TFE3 gene fusion have been described, resulting in deregulation of TFE3 transcription activity. The fusion of another number of the MIT family, TFEB, with alpha gene has been described in renal tumor harboring T611, P21, Q13 chromosomal translocation, and the first case of renal cancer involving a third MIT family members, MITF, was also recently reported, and a germline missense MITF mutation was identified at a higher frequency in family members affected with melanoma, RCC, or both compared to control, resulting in 5-fold increased risk for development of this cancer in ubiquitin cancer carriers of the MITF mutation. Codon 318 located with a small ubiquitin like modifier SUMO consensus site and the amino acid change caused by this mutation was shown to severely compromise sumoylation inhibition of MITF and thereby increasing its transcriptional activity towards HIF alpha among other targets, driving tumorigenesis, and tumor from individuals with the germline MITF transliteration demonstrate localization of MITS in the nucleus, where it incorporates with other MIT family members in regulating expression of the target genes that drive autophagy, lysosomal biogenesis, cell survival, and protection against oxidative stress.